Chapter 3: The Anti-Science Movement's Deadly Impact. A Crisis of Truth and Consequences. In the shadow of the deadliest pandemic in a century, a parallel epidemic raged, one of misinformation, political polarization, and deliberate distrust in science. This chapter exposes how the anti-science movement didn't just spread lies, it cost lives. This is not a story of abstract debate, but of real bodies piling up in morgues, of families shattered by preventable deaths, and of a public health system sabotaged from within. The anatomy of a man-made disaster. The data is irrefutable. Unvaccinated adults were 20 times more likely to die during the Delta wave. New England Journal of Medicine, 2022. Yet, in the face of this stark reality, a toxic alliance of politicians, social media algorithms, and celebrity activists waged war on masks, vaccines, and basic public health measures. Red states with anti-mask policies saw pediatric hospitalizations surge 45% higher than states with mandates. Journal of the American Medical Association, Pediatrics, 2022. Children paid the price for adult recklessness. Vaccine hesitancy, fueled by partisan rhetoric, became the strongest predictor of COVID-19 mortality, stronger than age or pre-existing conditions. Kaiser Family Foundation, 2023. Science was reduced to a political identity. The Playbook of Denial. This chapter dissects the anti-science movement's tactics. Weaponizing distrust. From pandemic conspiracies to attacks on Dr. Fauci, bad actors exploited legitimate frustrations with government to turn the public against life-saving tools. The social media amplifier, Facebook groups, and Twitter threads became echo chambers where rumors spread faster than facts. One study found anti-vaccine content received 4 times more engagement than factual posts. Nature, 2021. Political hostage-taking. When masks became a liberal symbol and vaccines a personal choice, public health became collateral damage in a culture war. The human toll. Behind the statistics are stories. A Tennessee nurse begging anti-vaxxers on her deathbed, "Please get vaccinated, I was wrong." Rural hospitals overwhelmed by COVID cases, while unused vaccines expired on shelves. Funeral directors reporting families who still denied COVID's existence as they buried loved ones. The anti-science movement didn't end with COVID-19. It's now targeting childhood immunizations, climate science, and even cancer research. This chapter sounds the alarm. Trust in scientists has plummeted from 87% to 62% among conservatives since 2020. Pew Research Center, 2023. 25 states have passed laws limiting public health powers, leaving the U.S. vulnerable to the next pandemic. Hotess, 2023. Fighting back. The battle against deadly misinformation isn't hopeless. Proven solutions exist. This chapter reveals how. Pre-bunking campaigns, which expose manipulation tactics before false claims spread, cut COVID-19 misinformation belief in half. PNAS Nexus, 2023. Equipping people with mental antibodies against lies. Unsung heroes. Doctors and community leaders restored trust in marginalized areas through grassroots outreach, achieving 68% vaccination rates in once hesitant communities by replacing skepticism with science. A crisis-ready roadmap, training trusted messengers, stress testing messaging, and deploying real-time rumor tracking can shield society before the next outbreak. These aren't theories, they're field-tested weapons in the fight for truth, tested in the darkest days of the pandemic and ready to be scaled. The next crisis is coming. Will we be prepared? Why this chapter matters. This isn't just about the past, it's about survival. Unless we confront the anti-science movement head-on, more will die needlessly. The data, the voices of the lost, and the lessons learned demand action. Turn the page, understand the threat, join the fight. The deadly math of vaccine hesitancy. When personal choice became a public death sentence. The numbers don't lie, but they do indict. During the darkest days of the Delta wave, being unvaccinated wasn't just a risk, it was a death warrant. Peer-reviewed studies in the New England Journal of Medicine laid bare the brutal calculus. Unvaccinated adults were 20 times more likely to die than their vaccinated peers. Let that sink in. Not 20% more likely, not twice as likely. 20 times. The equivalent of playing Russian roulette with a fully loaded revolver. The cost of hesitancy measured in graves. For every 100,000 unvaccinated Americans, 2,400 needlessly perished. A catastrophic toll that the journal Nature confirmed could have been slashed by 90% with vaccination. That's 2,200 lives saved per 100,000 people. Scale that nationally, and we're talking about hundreds of thousands of preventable deaths, enough to fill every seat in 4 Super Bowl stadiums. These weren't just statistics, they were grandparents who never met their grandchildren, nurses who spent a career saving others but couldn't save themselves, essential workers denied the protection their labor deserved. The silent heroes, how the vaccinated saved the unvaccinated. Here's the tragic irony. Even as anti-vaxxers mocked the vaccinated, they were being protected by them. Groundbreaking research in Nature proved that vaccinated individuals didn't just shield themselves. They reduced transmission to others by 62%, creating invisible force fields of immunity around their communities. The math is humbling. Every 10% increase in vaccination rates lowered countywide deaths by 18%. Schools with high staff vaccination saw 53% fewer student outbreaks. A warning for the next pandemic. The anti-vaccine movement turned a miracle of science into a partisan battleground, with body bags as the collateral damage. As you read these words, childhood vaccination rates for measles and polio are now dropping. Trust in public health has eroded to 1970s levels. The next outbreak is already hunting the vulnerable. This isn't just history, it's a roadmap for survival. The story you just heard in this chapter isn't just history, it's a warning. And this warning is not over. The policies, the failures, and the human cost we've documented in unnecessary deaths continue to shape our world right now. If you want to understand what happens next, you need to see the full picture. On this channel, we're not just releasing the audiobook, we're building on it. We'll be diving deeper into the data, tracking the real-world impact of the policies discussed in this book, and interviewing experts on the front lines of public health. By subscribing, you're not just getting the next chapter. You're joining a community committed to learning from the past to protect our future. Subscribing is the easiest way to ensure you don't miss a single video. The next chapter drops soon, and we'll be exploring how the anti-science movement's tactics are now targeting childhood vaccines. Here's what you can do right now. Hit the subscribe button. Click that bell icon to get notifications so you know the moment the next chapter is live. Check the links in the description below to get the full ebook on Gumroad and dive deeper at your own pace. The most dangerous lesson we can learn from unnecessary deaths is to look away. Stay informed, stay engaged, and please, subscribe. Thank you for watching and for caring enough to listen.